I'm Laura Ferris from the University of Pittsburgh. Today, I talked about lessons I've learned in melanoma. One of the things I started with was clinical pathologic correlation is important. So if what you get back on your path report doesn't match what you thought you saw in the patient, ask your pathologist to work with them to take a second look. The next thing I talked about were some of the tools that we have in making a biopsy decision. For example, gene expression profiling or devices. And that when we look at the data, we need to think about who was selecting the lesions, how were these used, and really compare their performance in clinical trials to what we see in practice. So for example, if we are using a tool only in lesions very suspicious for melanoma, we're going to probably have a higher positive predictive value than if we're only using it in the things that we really think don't need a biopsy, but we just want to make sure, for example. And then finally, I rounded out my talk with talking about managing complications of immunotherapy in patients with advanced melanoma. Talked about the different kind of skin reactions and how to manage things like bullous pemphigoid or lichenoid dermatitis in those patients.